Okay, let's understand arrhythmia. Okay, before understanding arrhythmia, we have to understand ECG. How you see understand the arrhythmia? Normally in daily life, we see the ECG, right? So when we see the ECG, then you see the different complex like P wave, QRS, okay, ST segment, these all thing. So what lead to ECG? Then ECG is all about it's a gradient, right? It's a electrochemical gradient, and what caused this? The process is this is the action potential. And while we talk about action potential, this action potential have altogether 5 phases: phase 0 to phase 4. Now we correspondingly see how what action potential mean in ECG or ECG complex. If you see the ECG, you probably have seen the QRS complex. Okay, what's happened during the QRS complex is simply the depolarization of a ventricle. Likewise, if you see an action potential, the phase 0 is also the phase of depolarization. What happened during this depolarization? Sodium and calcium channels, they opens, okay, which leads to the source of these voltage, so that there is the high QRS wave. And if we see about the ST segments, it's the correspond to the ST segments is phase 1 and phase 2, okay, and through ST interval to the ST T wave is phase 1, 2 and 3. What happened during this phase? There is the slow potassium channels, okay, sodium and calcium channels, they get closed, right? And what happened if there is a mutation is this in this slow potassium channel? Just imagine I says that ST segments is indicated by the slow potassium channels. So if there is a mutation, then the ST segment will be more longer, which means there will be the long QT. Okay, this leads to the QT syndromes. And this from T wave to next corresponding QRS complex is represented by the phase 4. Now we'll see how this wave travels. The wave started from the AC node, then it goes to the AV node. The time taken for the impulse to reach from AC node to AV node is indicated by the PR interval in ECG. Then, where the location of an AC node is the lateral junctions between the superior vena cava and right atrium. Then we goes here. From the AV node it goes to bundle of phase. Okay, the bundle is have two branches, right and left bundle branch. If you see the left bundle branch, it further divided into the two parts. Is a fascia, okay, fascicles. It's the left anterior fascicles and left posterior fascicles. And if you see about the anterior fascicles, they further divided into the Purkinje fibers, okay, and the locations of these Purkinje fibers are in the endocardium, okay. And you probably have heard the velocity of this impulse in the Purkinje fibers are the highest. It's all about 2 to 3 meter per second. And if you compare this velocity to the myocardial cell, which is only 0.3 to 0.4 milliseconds, then what's the reason for this? The velocity of these impulse in Purkinje fibers are high. It's all because of the number of connections present in the gap junction of a Purkinje fibers. So last over, then what's the direction of repolarization? It's from epicardium to the endocardium. So before starting all these things, we have to keep something in the mind. And what are they? First, if you see in the heart, there are two kind of cells. One are the myocytes, okay, and second is the nodal cells. If you see about the myocytes, okay, then what caused the phase 0 in the myocytes? Moreover, sodium channels are involved rather than the calcium channel. If you see the nodal cells, the calcium channels are more dominant to the sodium channels, and the natural properties of these calcium channels are slowly activated, and this is the reason why there is a delay in AV conduction, okay. So where does this phase 0 started? In the nodal cells. It started from the channels named sodium or funny current channels.